Very kind.
Sure.
Thank you. I'm Don Knox with the Home Care Association of Colorado. And first I want to say what a great presentation that was on APS. Really terrific, and I appreciate all you do. We didn't talk about how you're going to pay for the due process. It's going to be on mandatory background checks. And we have two issues, cost and speed. Speed is up to 10 days turnaround time. That's too long. It should be instant in most cases. And I prepared a report on how you can do it.
It's also at your place.
Yeah.
Instruments.
And then, and that's substantial because we imagine there are going to be about 120 to 150,000 checks a year. So if you do the math on the 10 days, 1.2 to 1.5 million business days lost. Pay days, care days, you know, it is huge, potentially. And it needn't be, you know, I was project manager for the Colorado Judicial Branch, contractor on the co-court system, which we were the first state to have online judicial records available. 2001, instant search, instant return. They tell us this is private data, and it's not public data. So it's not, it's not a comparable situation. But in 99% of the cases, it'll be a no-hit. There won't be a Chris Watney. There won't be a Bernard Busher. There won't be a Constance Rule in the database. Oh, it would be astronomically small that would happen. And it wouldn't be one of you. So there's no reason that search can't return immediately. And I'm told that it's a first name, last name, date of birth search, no social security number. That is exactly how the court system operates. And if you did get a return that wasn't a no-hit, then you can do the human investigation of the record. So at that stage, the screen would display, hey, it's taking a little bit longer, we're not going to give you an immediate return. But for the 99% of the cases that are no-hit, immediate return, person's hired, they're working that day. Really, really critical. Second thing, cost. A CBI background check is $6.85, a name search. Co-courts check, if you buy in volume, if you're a big hospital system or a home health agency, you can buy it for as little as $2.50 a check. You're proposing a cap of $35. The fiscal note had $16.50. This is going to come out of the agencies and out of the consumers, out of Medicare and Medicaid. All these costs are going to get passed to other people. So I do want you to be mindful of the cost and the speed.
Thank you, Mr. Knox. Questions for Mr. Knox?
Mr. Knox, was this a discussion item?
Mr. Davidson.
Oh, thank you.
Thank you. We do have people listening online, Commissioner Davidson.
Was this a discussion item during the passage of 17-1284?
Mr. Knox.
It has been discussed. Because more details came out about the system. Obviously, the $35 cap couldn't have been discussed because the fiscal note anticipated $16.50. I don't think we were provided enough information about the speed of the search. Frankly, it didn't occur to us in 2018 that we were going to use human-powered searches here.
Thank you.
Thank you.
Other questions for Mr. Knox? Thank you, sir, for
Thank
being
you
with us.
Thank you so much.
Mr.